I am Dr. Malik. Today we will talk about an important topic which we daily encounter. About minimum about 7 to 8 cases come to us daily. Whether it is intracerebral bleeding, bleeding inside the head, bleeding inside the brain, intracerebral bleeding. So this can happen because of accidents, or number two, because of high blood pressure, or any small things. I will tell you, in the blood vessels there may be some malformations in the blood vessels of the brain. I will tell you these three things: accidents and high blood pressure and small malformations in the brain. See, number one, what is the structure of brain? Number one, see, this is our head, this is our head. So this is called the large brain, this is called the large brain, this is the small brain. Both unite. This is called in the neck. See, the large brain, small brain, they both unite, and this in the neck you see medulla oblongata, and it continues as spinal cord. Spinal cord will be there only up to the middle of the spine. Only after the middle of the spine you will see spinal cord. So what are the layers around the brain? There are mainly two layers around the brain. This is brain, this is brain, this is brain. So first layer around the brain is arachnoid. Second layer around the brain is dura. So arachnoid and dura. And see, outer one, this is the skull. Outer one, this is the skull. So the arachnoid is tightly adherent to the brain, is surrounded by arachnoid, and arachnoid is again surrounded by dura. See, between the arachnoid and the brain there is a fluid called cerebrospinal fluid. Brain is surrounded by fluid is surrounded by arachnoid, that layer, and arachnoid is surrounded by dura. That is the structure. So that fluid will help the brain to have a movement, also safe movement, something like a shock absorbing type. Okay, so how many types of hematoma? Suppose there is an accident or there is an internal high BP bleeding. What type of bleedings occur in the brain? Number one, extradural, that is, this is the one. The brain is like this. The arachnoid is around. The dura is also around. So between the dura and the skull and the dura, between the layers of the brain and the skull, there is bleeding. This is called extradural bleeding or epidural bleeding. Okay, and this is simple. This happens only in accidents, not in any other situations, only in some injury to the brain. So this is called extradural or epidural, and it can be simply removed by us putting a small burr hole. They will put, neurosurgeons will put a hole here, they call burr hole, and they remove the clot. And number two, subdural hematoma, subdural bleeding or subdural hematoma. Hematoma means clot. So this is between the skull and below the dura. Dura is a covering, we know it. Brain, CSF, subarachnoid, and then dura. So below the dura, the cover of the brain, below the dura, the cover, this is the subdural hemorrhage. This is the bleeding. This is what I heard it happened to our Sri Sadguru recently. He didn't notice it. He came to know it little later. He was having severe headache and all. He was done surgery. My opinion is that he must have had a slight small head injury sometime. Maybe not obvious. He might have noticed, didn't notice. Maybe a small injury while going to toilet or whatever it is. We don't know. But a small injury can cause it. Usually it doesn't. It is not caused by BP and all. Usually injuries are small head injuries, and sometimes people who are using aspirin and people who use blood thinners, they can have, even with a small injury, they can have bleeding anywhere in the body. And one more reason, suppose there is the patient had some fevers, dengue fever, etc. The platelets are very low. Then also bleeding can occur in the brain or any organ. So this is called subdural, below the dura. This is above the dura. Above the dura and the skull, this is below the dura, there is bleeding. They put a small, again Same thing. They put a burr hole, neurosurgeons put a burr hole and take it out. So the third one is subarachnoid hemorrhage. Subarachnoid hemorrhage is, I told you, there is one layer which surrounds tightly around the brain. It is called subarachnoid. Inside the subarachnoid also they can be bleeding, and in head injuries or in high hypertension. Suppose the patient's hypertension shoots up. Usually in the first two varieties, extradural or subdural, usually BP and other things are not the causes, only injuries are the causes. But here, injury can be the cause. In subarachnoid hemorrhage, injury can be the cause, or injury, some accidents or some head injury can be the cause, or some blood vessel malformation. Suppose there is a small bleb-like thing in the blood vessel of the brain from the childhood. It may burst at any time in your later age. That can also occur. That we see very rarely, but these are not uncommon. And fourth one is intracerebral bleed. Bleeding inside the brain. Maybe number one, accidents, or maybe high BP, or the third one I told you, maybe an artery malformations like small blebs in the brain blood vessels. They can rupture at any time. From childhood they may be there. Some venous malformations, these can be there. So this is the one. See, there will be bleeding somewhere here inside big. So usually if it is big here and there, 3 to 4 places, no surgery will be done. But it is one place huge, people do surgeries. And the last one is massive bleeding inside the brain. Massive bleeding inside the brain, causing midline shift. See, this is left part of the brain, right part of the brain. Two parts unite. Left part, right part, left part, right part, left part, right part. They unite. Usually, whether it is the large brain or small brain, small brain or large brain, they are into two pieces. They are right side, left side. They are two pieces. So they are joined by a connection. It's called isthmus. They are connection. So in this huge bleeding on one side, the center of the brain is pushed. This is called midline shift. This is very dangerous. This condition is very, very dangerous, and I think sometimes it is life-threatening also. Mainly here, when the bleeding occurs in the brain, there is an important thing is, suppose right side there is bleeding, or right side there is compression. What are the signs? First thing is, whenever there is, the head is swollen, edema, that is, the brain is swollen because of some injury or something. So any swelling in the brain causes, first thing is vomitings, severe headache, vomitings, and convulsions also. There is swelling in the brain because of injury. First thing is severe headache. Number two, the patient can have vomitings, and there it may not stay. If the intracranial pressure is too high, patient can have convulsions, fits also. Here, one more thing is, whenever a patient had head injury, 24 hours hospital admission and observation is a must, because these things, headache, vomitings, and fits, these things. One more thing is, if there is a paralysis, suppose there is right side, there is big bleeding. The paralysis occurs on the left side, because left upper hand and left lower leg. If right side there is a bleeding, and if left side there is a bleeding or compression, the paralysis occurs on the right side and right leg, because then usually at the neck, the nerves, they cross. It's like crossing of the nerves. So usually if you have right side problem, you will have left side paralysis, and if you have left side problem, you will have right side paralysis. This is very, very important. So I think you must be very, very cautious. Whenever there is a small head injury, you must be very cautious, and 24 hours observation is a must. You should not take it lightly. 24 hours observation is a must, and you must observe for all these signs, whether there is any headache, any vomitings, and lastly convulsions, fits. These are all dangerous things. So be cautious.